Okay, and let me give you the controls back. Sorry for that interruption.
No worries. Okay, so going back, once you've gone through both iterations, you're to submit the finalized curriculum and the quality improvement summary, okay? And so for those who implemented spring of this year, you submitted that August 2nd. And we've received some, but if you haven't submitted it already, please get that to us as soon as possible. For those of you who are currently implementing or just finished in summer, you would submit your finalized curriculum and quality improvement summary September 27th. And those implementing in fall wouldn't submit it until January 31st. And we thought this would give you enough time to kind of gather all of the feedback from faculty, students, and other stakeholders and implement changes. Once the finalized second iteration is submitted and all packaged up, that's when we will disseminate nationally. So it's not until we've gone through that quality improvement process that we'll disseminate the materials. So just to remind everyone about the quality improvement summary, this was a document that Margaret sent out a few months ago, I believe, in an email update. But just take another look at it. This is just for a couple of purposes. One, for grant purposes, we need to indicate that we have gone through a quality improvement process and that we've really taken a look at our curriculum, piloted it, and made appropriate changes based on stakeholder feedback. So this is just a summary to indicate first who you elicited feedback from, so students, faculty, administration, industry, potentially alumni for some programs or in the future. What was that feedback? So a summary of the key points from that feedback. And then if you look at part C, anything to kind of what you gathered from that feedback that commented on the effectiveness of the course materials. And one thing to think about here is not only whether the students were engaged with the course materials or liked it, but how much did they actually learn from the course materials? So a great indicator for this would be test scores, questions on quizzes. If multiple students got the same question wrong, this would inform kind of the effectiveness of the materials or maybe the effectiveness of the quiz question, and so on and so forth. And then part D clearly indicates where in your first iteration you made changes. So you identify the module and the topic, what section, was it learning outcomes, materials, activities, discussion questions, or assessments, and then what type of revision did you make? Did you delete something, add content, or modify existing content? And this latter part really helps me for when I kind of review the curriculum. I can quickly see where changes were made, and it just makes the overall process much more streamlined. Are there any questions so far?
Brooke, we have a question from Matt that he chatted in. Do we need to get feedback from all of the listed stakeholders? We are having a hard time getting industry to respond to our requests.
Yep, good question, Matt. I mean, ideally, yes, the more stakeholders you can get feedback from, the better, the more informed the curriculum is. But we understand the limitations to that. So I think the two to really focus on in this case are students and faculty at the minimum. And then any other feedback that you can get beyond that, excellent. Good question. Any other questions? Okay, so I just wanted to take a quick look at an example of one of the curriculum specialists submitted, Vivian. So this is a completed quality improvement summary. So she elicited feedback from students and faculty, and she told us how the students completed a questionnaire, the faculty reviewed the course, and then summarized the key points from the feedback that she received from students and faculty, and then went on in a little bit more detail about the feedback that she received from both students and faculty and how that informed changes or the effectiveness of the course materials. And finally, down here, we can clearly see which module and topics that she made changes to, which section the changes were made in, and what type of change was made. Okay, so that's just an example of what your completed form might look like. Are there any other questions? Okay, great. I'm going to pass the controls back to Margaret.
Thank you, Brooke. And before we totally leave the topic of version 2, one thing we'd like to see in your version 2s are any places where you used ONC materials. We've gotten more information on the details of the license, that the Creative Commons license that the ONC is using, and we can use their materials, no problem, but we're supposed to give credit to them. So if you incorporated activities that are directly from the ONC or quiz questions, please indicate that they are from the ONC. Okay, any questions on that? Okay, I'd like to share with you some updates on CA HIMSS. Just share my desktop here. All right, so we mentioned last time we connected that we were in the process of doing a version 2 of CA HIMSS materials, both the materials that are on the HIT education site and those that are on the Enter site. And what's different is that we've gone through and ensured that the materials and the objectives are fully aligned. And we've also gone through and identified any potential gaps in material that might affect student performance on the certification exam, and we've filled those gaps with additional content. So all of these updates will be finalized by the end of next week. So if you've been holding off waiting to upload ONC content from CA HIMSS to your course sites at the end of next week, feel free. And Nathan, you're on the line. It is the end of next week, yes?
Yeah, but at the end of next week.
Okay. And then one other point on CA HIMSS. We have been working with Carnegie Mellon University, and they have a nationally known MOOC called the Open Learning Initiative. And we'll be working with them through October of 2014 on all 9 of the CA HIMSS units. We've completed the first one, the unit on healthcare, and if you would like to have your faculty link directly to this course, let me know and I'll give you instructions. But first I wanted to give you an indication of what it is that's available. Basically, the authors, and we're working with another TAA grantee from Missouri on this project, along with Carnegie Mellon and CAST. CAST is an organization that's involved in universal design of learning. That is learning that is effective for all different types of learning. It includes accessibility, but goes beyond that. So we take the ONC content and look at other sources as well and distill the content down to the key elements and then create learning activities to go with these elements. So here's an example of an explanation of long-term care facilities. And you'll see there's explanatory content. And in this case, the author did something really cool. She wove scenarios right into the explanatory content. She invented characters to illustrate the different features of long-term care. In the Carnegie Mellon versions of CA HIMSS, you'll see more visuals and the content really chunked up in a way that's very accessible to students. And you'll also see things like this. They're called Learn by Doings, and they give students, they provide a mechanism for students to interact with the content. So a student reads these first two sentences. If they're really not sure, they can get a hint. And then they select their answer, and they get feedback on every response, both correct and incorrect. Okay, and it goes on. Again, you see more visuals, more learn by doings, and then there are assessment questions at the end of every module. So it's a very labor-intensive process, and if you think any of your faculty would like to use this material, please let me know, and I'd be happy to connect them with the OLI, the Carnegie Mellon OLI team to make that happen. Any questions on that?
Add to what Margaret said too, the Learn by Doings where students receive hints and feedback on correct and incorrect answers, that's something that we can do in storylines. That's very similar to what a storyline activity might look like. So if you all have activities where you would like students to get kind of more targeted feedback on their responses, or even provide kind of a scaffolding with hints, we can do that with storylines. So just something to keep in mind.
Yeah, thank you, Brooke. So don't hesitate to ask us if the technology is a hurdle. We have our very own Roger Adams, who's here with us on the webinar, and he can convert any ideas you have into, he can provide the technology to make that happen. Any other comments or questions? So just to reiterate, the content from the first of 9 units of CA HIMSS is now available on the Carnegie Mellon site for faculty to use, and just let me know if you have anyone interested. Okay, development of lab activities. Nicole, I'll pass you the baton.
Thanks, Margaret. And hi, everyone. Let's see. To get started with, the EMR Star is launching here very shortly with our friends at NOVA being the first group right out of the gate. And Elliot yesterday recorded a faculty introduction or orientation to EMR Star, and there are already a bunch of activities created for EMR Star that are targeted towards both more clinical type of students as well as more administrative, and ones are in the works right now for IT folks as well. So, so we do have some activities right out of the gate that we can use, but I know some of you are thinking about creating some additional activities, and maybe some of you would like to and just need some more information. So that's what I wanted to share here with you right now. And let me, I'm going to actually go to showing my, share my desktop really quickly. And whoop, here we go. What I wanted to show you right here to kind of get started is this is another template essentially, and there are some things that we want to think about when we want to start creating an EMR Star activity. We can begin with thinking about a patient, the activity, and then how we're going to grade it. And so let's roll down and see what several of these sample patients look like. Elliot and his team have created a handful of kind of canned patients, if you will. The first one being Norman Normal. And we have a little paragraph giving some background information about who Norman is, and then some patient information. Some of the activities that currently exist in EMR Star have the learner working with this content that you see up here on the screen, and being able to input it directly into the EMR, or working with this information once it's in the EMR to complete some activities, if you will. And as you can see, we've got kind of the basic patient information, and then we get a little more information about what the latest physical exam might have looked like. Norman Normal doesn't have a lot going on. So we also have a couple other patients, and here's an example of another one called When Wheezing. Once again, we've got some basic background information to help kind of paint a picture of who this patient is, and maybe what her, where she's working, what's going on, create a profile. We also have that patient information and a little more detailed physical examination of some other things going on. So giving us some additional profiles to work with in there. And in this document, which we'll send out later on, also created an opportunity for you to essentially have a little template to work from to be able to create a basic patient profile right here. And then these are the topics, once again, I should say the areas that we're looking to gather some additional information on. And why this is helpful is the EMR works best once we have some data in there to play around with, to maybe search on, to manipulate in different ways, to really get to see all the different functionalities of the EMR in action. So having some of this additional information, particularly things about maybe different appointments the patients had or different outcomes, and tracking that in there really starts to create a much more robust picture for the learner. So as you're beginning to think about creating activities, start to think about creating a particular patient. If you're looking for activities with farm tech, issues or situations about laboratory or medical reports or other issues, we might see things filled out in a little more detail here about prescriptions or other indications or contraindications. And as we move, we'll move back up here to the top and actually look at this template. I know when we say template, everybody gets a little twitchy, but think of this more as just some elements to think about when you want to start thinking about creating an activity. What would be helpful for Elliot and his team to be able to move forward and start to create the profile and the activity in the course to make it come live for you. So this is the type of data we'll want. The activity name. There is currently one EMR platform, open EMR platform that's up and running. Vista will be up shortly this fall, and following behind that will be open MRS. And think about the target audience. Can any student take this, or is it primarily students, clinical students or IT students, or is it geared towards farm tech students? So who's the target audience? What's the purpose of this? And this will tie in with some of the curriculum work that you've been working on particular topics and trying to create application for particular activities. And we roll down kind of that clinical scenario. What's really going on? Why do we care from a clinical perspective? Of what do we want to, what do we need to know about this particular patient or patients so that we can make it as authentic as possible? and looking at the learning objectives where it crosswalks back to the curriculum. Then design and development directions. If there's very specific things or feedback that you want to convey to the students, also the steps or functions that the student will need to do to be able to perform that activity. And we have examples, thanks to Elliot and his crew, of what those might look like. And then, of course, grading. Grading can fall into a couple categories. The one category is if you want screenshots of students completing the activity in the EMR, or if you would like, if the instructor will go in and actually see that a patient was created, you know, if that suffices. And so what does the actual activity look like? And then there's the opportunity to also create kind of assessment questions that kind of test what they've just covered there. And so Elliot's done some in the examples that he's created, and right here we can see some of them. And the yellow highlighted is correct answer. So enter OpenEMR as the receptionist and explore access to the system. Which of the following activities are available for the receptionist access? And the learner just selects the right one. So kind of tying it all back in there. So I wanted to show you that just so that you know that there is a kind of a format of that you can follow that help guide you as you start to think about activities. The blue text in here is just some sample information so you can see what's helpful for Elliot. And then down below, as we showed all the way down here, is some kind of guidelines or a little template to help you think about crafting a particular patient. Now, let me get back to the, whoops, sorry, the WebEx presentation here. And one second, I guess I'm sorry, folks, don't mean to make you busy on here. This is just finally showing you an example that Elliot's created. This is exercise 3. It's a workflow exercise about documenting a new patient encounter. And this is capturing that information underneath those design steps. What does that learner need to do next? And you can see it's not too detailed. There's, you know, 6 different little steps to complete here to be able to do something. And here are the questions associated with that. Another exercise here, this one really only has 4 steps. And this is capturing patient's health information and then some questions associated with that. So as you can see, it's there's a little bit of thought into working with that particular platform, and it's also pretty doable and pretty approachable because it's just kind of spinning content in the environment and allowing the learners to play with the different fields and as you design for that, think about it from the learner's perspective on, what would be helpful for them to play in there. So with that, I'll kind of open up to any questions. Anybody have any questions or comments about this? Give the presentation back to Margaret.
Thank you, Nicole.
Sure.
Any questions for Nicole on this? Okay, well, any questions or comments about anything curriculum or grant related? Everyone's very quiet today. Ah, I hear someone.
I was just going to say I've got no question.
I'm curious, in your chat box, we also have some activities that we're going to share, but before we do that, I would be very curious to hear what is your biggest challenge right now? If you could type in the chat box and be sure you have on the drop-down arrow, have everyone selected. Pat said we're all worn out. Okay. What's your biggest headache or challenge at the moment? Can you chat into the chat box? Working with faculty to get material in. Well, I see we have a common refrain here. Getting the attention of busy faculty. Yeah. Anyone have any tips to offer in that respect? I know someone had mentioned that if you wait until something emerges from faculty, you'll be waiting likely a very long time. But if you can create something that they can then react to, sometimes you have better luck. If anybody has tried that to good effect, if you could unmute your mic and talk about that. Brett said he can't think of any methods that would be polite. And Emily, again, working with faculty on deliverables. Oh, Bonnie, you've tried, how about this? And it doesn't work? And Vivian, yes, they are getting extra money for the work. It is frustrating. And I know, Bonnie, that strategy didn't work for you. Anybody else had luck with presenting something to faculty and having them? Okay, the next best thing is if the manager is the pusher. Yeah, we've seen in a lot of colleges you have to escalate it to the project manager, and then they in turn often have to escalate to a dean to try to make something happen. And Rachel, yeah, the money carrot, we have found mixed results with that in our experience. But with some faculty, the money just doesn't make anything happen. Others, it can. Bonnie, I'm hoping that when they actually use the materials in class, that then they'll respond. Yeah, that'll be nice if they can see the value of it. And Emily, I think our faculty didn't know how much work and what would be involved. Yeah, people often say yes easily when you're like, sure, would you like a stipend? Or here's a project that we'll be working on in the distant future. And then when it comes down to it, sometimes people didn't realize how much work is involved. Yeah, but Bonnie, you know, your hope is that I really like to keep that idea in mind that, I mean, faculty are interested in their students and their student success. So I'm hoping that once they implement and get good responses from the students and ultimately from employers, that will shift things. Yes, Vivian, if they can see the value of it, it helps them. Yeah, and presenting them with something that's partly done. Any other comments? Oh, and Brett, you're in the same boat as Bonnie. You're trying that, but still having challenges. And I think one of the challenges, particularly with the nursing programs, is that their programs are just so jam-packed already that it's hard to squeeze something in. But if you can tack on very small activities that don't take up much time and that students can do on their own, that could help. Bonnie, you develop most of the farm tech materials yourself, and you're not a farm tech. Yeah, that's a challenge. If anyone has any golden bullets to offer up, please do unmute your mic and speak up.
I think I completely can empathize with all of those challenges, and we're experiencing some of them ourselves in terms of developing some of the CA HIMSS curriculum, as we're not content experts. And that's where I think, I find myself going out and doing a lot of research on a field that I know very little about. But that's where I think some of the, and I know we keep saying this, and I know they're really dry materials, but some of the ONC content does provide at least industry vetted materials. So you know that the content that you pull from there and manipulate in a way to make it more interesting will at least be valid. Now, I know in some of your cases it's not what the faculty want, or they feel it's not relevant to their programs. But it's at least a starting point in terms of having valid, reliable material or source material. And they actually, if you go to the end of those lectures, will point to all of their primary sources for developing that content. And I found that to be a really useful resource when I'm trying to learn about these topics. So that's just a thought in terms of when you're, trying to learn this new content area and then develop materials on it. Then at least you can kind of get creative with the activities and assessments and move back to the faculty with, here's some content that's relevant, but do you want to does this activity look good or not? Yes or no, and how can we change it? But yeah, there's no easy answer, and I can definitely empathize with all of these concerns.
Oh, great suggestion, so Brooke, thank you. Yeah, I think everyone needs to just do their best with the resources at hand and try to get faculty to implement some of the materials. But I think if we wait, we won't end up with anything. So I think just pushing forward, doing the best we can with the resources at hand, and taking your best guess in terms of creating context for the health IT materials that will be relevant to the programs you're developing for is the best we can do. And there are some topics, like we know that nursing students benefit from learning about workflow, for example. So there's no downside to developing some materials in that direction and floating them by faculty. Any other comments? Oh, Bonnie, I'm glad that you have an interest in CA HIMSS. And I'll be following up with an email to everyone about how to access that first unit. And they'll be releasing the second unit probably in December. And they'll be releasing units all the way through the year between now and October of 2014. Well, Bonnie, you wrote, oh, you were involved in the test questions for CP HIMSS. Interesting. Oh, okay, Emily, showing them the OLI stuff. Yeah, and it has kind of the cool factor too. It's really easily accessible from a cognitive perspective, and a lot of things to play with. Matt, yes, I do have a list, and I can send that out along with the information on how to access the OLI materials. Vivian, your school wants to create all of their own materials to cover the CA HIMSS curriculum. It's not a problem at all, but wow, that's going to be quite an undertaking if they're not using the ONC materials at all. Oh, they will use the ONC materials. Yeah, and you know, you might encourage them to take a look at the OLI materials, and you don't have to use it wholesale. You could even take some ideas from those, and we could create storyline activities, or you could use them in your own learning management system. Any other comments or questions on anything? All right, well, Brooke, I'm going to turn the controls back to you again so that we can look at a couple of examples of learning activities developed by the consortium.
Just to go through, just to point you back to some other resources that we've been sharing on the Health IT Education website, the Health IT instructional materials. So remember, if you go up to the top toolbar, down to curriculum development resources, you'll see Health IT instructional materials here. And I've been posting a few things coming in from various, not only curriculum specialists, but actually some faculty have sent me some PowerPoint decks and some things that they've created that I know some of you have actually used in your own curriculum, which is great. But just to point you to them again, if you think that they're useful for your own infusion or certificate pieces, here they are. And I'll just slide down to kind of show you some of them. These are some videos that I added that were on kind of, some of you are covering Affordable Care Act. This is a really fun video that explains Affordable Care Act, consumer health informatics. And then here are some PowerPoints created by Bellevue College's nursing faculty on various topics that they're using for their infusion piece. And this is all open source, so you're free to use that and modify it however you like. But I wanted to take a look at a couple activities just to kind of iterate that, you know, your activities don't have to all go into storyline. I know we've been reminding you of that frequently, but they can be really simple, yet really kind of engaging. So I want to take a look at an activity created by Matt from Clover Park. And this is just a simple scenario activity, but it's great because it really just it kind of takes it to the next level rather than asking some questions or rather having students just do a reading. So this is for infusion into the hemodialysis program over there at Clover Park, and it's covering usability. And we looked at another activity earlier from Vivian covering usability as well. So here's a different one. So you have a scenario here about a patient who just turned 65 and goes online to look at Medicare prescription drug coverage. And then Matt has them kind of consider these 2 points in terms of usability. But what I like that he's done here, he doesn't just stop there, but he also provided an opportunity for faculty to assess students' performance in the activity if they want to. Now, we all know not all activities are assessed, but if they want to use it to kind of, as a formative assessment, see where students are getting caught up, he provided an opportunity for that. So really simple, doesn't need to be in fancy storyline or anything like that, but this is what we would call an active learning activity that's a little bit more engaging. Another one I want to show you is from Spokane, and this was actually created by faculty at Health Information Management faculty at Spokane, Amy Bledsoe. And I wanted to show you this one because a lot of you have incorporated great articles and readings into your curriculum, and you've probably seen some comments from me that ask you to take it a step further, where students don't just read the article, but then they actually have to do something with the information. And you know, sometimes that may be just writing up some comprehension questions after the article, or maybe some more thought-provoking discussion questions about the content in the article, which are all great. But I just wanted to show you another way that faculty used a couple articles on meaningful use, talking about stage 1, stage 2 of meaningful use criteria. And, you know, the objective here was to identify the differences and similarities. So rather than have students just read the article and then maybe something like list the differences or list the similarities, she had them create a couple tables, one that was summarizing the criteria in stage 1, and then another table that was summarizing the criteria, in stage 1 for eligible professionals, and then one that was summarizing the criteria in stage 1 for eligible hospitals. And then she had them create a Venn diagram of the 2 stages to kind of highlight the similarities and differences. So here the students aren't just reading the article, they're reading the article and then processing the information and presenting it in a new way. So they've had to really manipulate that information, which enhances understanding and enhances learning. So just something to keep in mind when you guys do use reading. And then the last one I wanted to point out was something from Pierce, from Emily. This is a research paper, which a lot of you have had some activities where you have students write paragraphs or research papers on a particular topic. And what I liked about what Emily did here is rather than just say, write a research paper about X, she really outlined what students should cover in their research paper. So she has this bulleted list here with follow-up questions to outline the specific items that students should touch upon. And this just provides much more guidance for the instructor, much more guidance for the student, and also ensures that you're hitting upon each of your learning objectives that this research paper might be addressing. And she didn't stop there, but she then continued to develop a grading rubric for the instructor, which as a teacher myself, I love it when I have a grading rubric I can already go from, or at least modify and use for my own purpose. But it's just great to have a starting point rather than creating these things from scratch all the time. So yeah, just wanted to show you all of these activities, and just to remind you to kind of check in here for different materials that are uploaded. There's a tag word cloud over here, so you can kind of search based on topic, or you can always search up here in the search bar for something specific. And yeah, I hope to keep adding to this as more materials come rolling in. Any questions?
Thank you, Brooke.
Margaret, I'll pass it on to you again. And Emily says we're big on rubrics at Pierce.
All right. Any final comments or questions about anything? Anything you'd like to see covered in our next get-together? If you think of something you'd like to cover, feel free to drop me an email anytime. All right. Well, good to connect with all of you again, and hope you have a great afternoon.
Thanks, you too, Margaret.